Imagine if you were a caretaker of an infant and the infant suddenly becomes unresponsive. Would you know how to respond? Do you know that 70% of Americans do not know how to perform infant CPR? It only takes 3 to 4 minutes for an infant to become brain dead due to a lack of oxygen. What a terrifying experience it would be if a precious infant became unresponsive in your arms. Good morning, and today for my job skills demonstration, I will be explaining how to perform infant cardiopulmonary resuscitation, also known as CPR. The materials you'll need are an infant CPR mannequin, an infant CPR mask attached to a one-way breathing valve, and gloves. An infant CPR mask attached to a one-way breathing valve is used as a safety precaution to protect you from an exchange of body fluids. If an infant CPR mask is not available, you may use your mouth to cover over the infant's nose and mouth. But if you do not feel comfortable putting your mouth over the infant's nose and mouth, you may continue with just chest compressions until help arrives. Gloves are also used as a safety precaution to prevent the spread of infection. To begin, lay the infant on a flat surface. Tap the infant's feet while calling their name to find any signs of responsiveness. Check to see if the infant is breathing by watching their chest rise and fall. If the infant is unresponsive, activate the emergency response system by directing someone to dial 911 and retrieve an automated external defibrillator, also known as an AED. An AED is an instrument used to shock the infant's heart back to its normal rhythm. For my demonstration today, I will not be using an AED. At this time, you would apply your gloves. Using your index and middle finger, locate the infant's brachial pulse located in the inner aspect of their upper arm. Press gently for 5 seconds, but no longer than 10 seconds. If the infant does not have a pulse, you would begin chest compressions. To do chest compressions, take your index and middle finger and place them in the center of the infant's chest, just below the nipple line. Placement of your fingers while performing chest compressions is a safety precaution because improper finger placement could result in injury to the infant. Once you begin chest compressions, press hard and fast at a rate of 100 compressions per minute and at least 1/3 the depth of the infant's chest, which is approximately 1.5 inches. Also be sure to allow the infant's chest to recoil in between each chest compression. This allows blood to flow sufficiently throughout the infant's body into the body's vital organs. After you have completed 30 chest compressions, you will then give 2 breaths. To give the breaths, begin by placing the infant CPR mask on the infant's face. Place the narrow side of the mask where the infant's nose is and the wider side where the infant's chin is. With the hand that is closer to the infant's forehead, use your index finger and thumb to seal the outer edge of the mask. Use your index finger and thumb of the other hand to seal the bottom edge of the mask. Gently tilt the infant's head back. This will open their airway. This is called the head tilt chin lift method. Then give the infant 2 breaths, making sure that they are no longer than 1 second each and that the infant's chest completely rises. Be sure to check the infant's pulse after every 5 cycles of CPR. And if the infant does not have a pulse, continue CPR until further help arrives or the infant begins to move. I'm now going to demonstrate 2 full cycles of infant CPR. Baby, are you okay? You, call 911. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. To recap, first, check the infant for signs of responsiveness. Then, check the infant for signs of breathing. Activate the emergency response system by directing someone to dial 911. Check the infant's brachial pulse for 5 seconds, but no longer than 10 seconds. Perform 30 chest compressions at a rate of 100 compressions per minute and at least 1/3 the depth of the infant's chest, which is approximately 1.5 inches. Place the infant's CPR mask on the infant's face and perform the head tilt chin lift method. Lastly, give the infant 2 breaths, making sure that they are no longer than 1 second each and that the infant's chest completely rises. Be sure to check the infant's pulse after every 5 cycles of CPR, and if the infant does not have a pulse, continue CPR until further help arrives or the infant begins to move. At any time, a precious infant could become unresponsive in your presence and require your help. By knowing how to perform infant CPR, you could save the life of a cherished infant. By just listening to my job skills demonstration, you could become one of the 30% of Americans who knows how to perform infant CPR. Thank you for your time, and this concludes my job skills demonstration.